The range that I use for an optimal range is about 600 to 900.
Yeah.
And that's where most men will feel their best. There's not one number that's right for every man. And a lot of guys, the first thing that they think about, well, more is better, right? That's the
Correct.
first thing that we always think about.
Yeah.
That's not always the case. There are men who will feel fantastic with a range, with a number of, say, 600. And there are men who don't necessarily feel great, and their number might be 800
Yeah.
or more.
Okay.
So sometimes you have to go a little higher. Sometimes you're a little bit lower. I'm not always trying to get somebody into the highest range. I'm trying to get them, into that optimal range,
Yeah.
and then correlate that with how they're feeling. And that's really the important thing. You have to talk to the patient, right? It's not just the numbers, it's how are you doing.
Correct.
So when a patient will come to see me, we want to figure out what's going on with them. So you want to think about what are their symptoms and what's bothering them, and then which baskets does it go into.
Okay.
So when somebody comes in and they're saying that they're fatigued, your first instinct might be testosterone, but it could also be a whole host of other things.
Absolutely.
How are they sleeping? Do they have sleep apnea? What is their thyroid like? What is their exercise routine like? There are so many different factors that could cause a man or a woman to feel fatigued that to just say, all right, let's just look at hormones would be a disservice to them.
Absolutely.
So when we think about testosterone, first thing is do we need to even be concerned about it? So if I have a young man and his complaint that he comes in with might be, say, stomach related, so it might be a GI issue, I'm not necessarily thinking of testosterone right off the bat for them.
You bet. You bet.
But if I have a gentleman who's in his 50s and he has a constellation of symptoms that sound like they could be from testosterone, then we start delving into the numbers and getting lab work to really see if that's the issue.
To see if that plays a role.
Correct. So not every man or woman that comes in my practice is getting a testosterone level, but the folks that have that as a concern, we're definitely going to investigate it. What are some things that we think about that would make us think, is testosterone playing a role here? So certainly energy levels. How is their zest for life, their motivation, their drive? How is their sex drive? How is, in a man, erectile function? In a woman, libido is obviously going to be important. How is your recovery after workouts? Do you have these injuries that just don't heal? How do you feel like your workouts are productive? Now, the interesting thing is, most people think that if your sex drive is intact, you can't possibly have a low testosterone. And I think from an ancestral standpoint, libido is one of the last things to go in most men. I mean, we're meant to reproduce.
Yeah.
And so a man can have fatigue, and they can have really non-productive workouts, have difficulty putting on lean muscle mass, difficulty with recoveries, feel like life is blah, but still have a decent libido, and they think, well, there can't be anything wrong with my testosterone, but quite a few symptoms that say otherwise. So when we start getting some of those symptoms, that's when we start thinking about getting lab work, and then we'll get a full panel, not just of testosterone, but also the metabolites of testosterone. So testosterone will get turned into either estradiol or dihydrotestosterone,
Correct.
also known as DHT. In a man, we're going to check his PSA, prostate-specific antigen, just to make sure his prostate health is where it needs to be.
Yeah.
We might check some other things like prolactin, so that we know that if somebody has an elevated prolactin level, that can suppress testosterone. And so sometimes we will discover that somebody has a benign tumor in their brain called a prolactinoma that is producing too much prolactin, which is suppressing the testosterone. And if we deal with that, then the testosterone will correct itself, and that can be in a man or a woman. We'll get DHEA
I'd
levels.
like to continue about that at some point.
Yep.
Because I know somebody who has fighting prostate cancer, 54 years old, had high prolactin 80. So I said, the only way you probably have to go on some medication, cabergoline or something, is it called? Is that correct?
Yes, it is.
And so it brought it all the way down, but the testosterone is not coming up yet. But also elevated prolactin can cause prostate cancer, can feed prostate cancer.
Yes, that's one of the theoretical.
Yeah.
Cancer is so
I know, it's
multifactorial,
broad.
right? But yes, you're right. It's one of the theories about what's going on. So yes, so sometimes we'll find somebody that when you're doing this fishing expedition initially, you'll come across something like that, and then they may not have had any symptoms related to their brain, and then you get an MRI and you find the prolactinoma, and fortunately, most of those folks can be treated medically. They don't need surgery to remove it. That's the nice thing about that.
Good.
So we'll do this vast array, of hormone tests, specific for sex hormones, and we'll we'll do for women. The only other one that we might add is progesterone, depending on the age of the woman, and then we go from there.